Tom Dalton, CEO of Neami National.
Hi, I'm Tony Nippard, the Chair of Neami National. We're going to spend a few minutes sharing our achievements of 2019 and 2020, the impact we are having and how we want to continue this work. Firstly, we must start with COVID-19, which has had such an enormous impact on everything in 2020. What we have been through and are still going through as we prepare this annual report has demonstrated the depth and capabilities of our teams and the resilience of our extended Neami family. The challenges have tested us all, and the strength of our relationships, our recovery approach has meant we have maintained consumer support and safety. The board recognises the enormous support and goodwill of all involved who work together to successfully support our consumers, our staff and our communities.
How our teams adapted is remarkable, as is the way the sector came together and kept important conversations going, sharing what was and wasn't working. We learned a great deal about Neami as we responded to the pandemic. Like others, we found ways to safely provide our services, including using telehealth, and we added research to better understand the experience for consumers and staff, to support us to build new models of engagement. In New South Wales, Victoria and South Australia, we partnered with other organisations and government to provide emergency accommodation for people experiencing homelessness to keep them safe. This gave us insight into how we can eradicate homelessness with the combined effort and will. In response to need, we quickly implemented some COVID-focused services to help manage the pandemic's impact on mental health and wellbeing. In the foreseeable future, this will be an ongoing need which we will continue to advocate strongly for. Underpinning all this work was our organisation's DNA, which is to listen to individual needs and then provide safe and ongoing support to improve wellbeing. This pandemic gave us insights into our strengths and also where we can do better and have greater impact.
Before COVID, in late 2019, we embarked on an extensive consultation process to develop our new strategic directions. It was a major body of work for the year, and the outcomes gave us a strong sense of purpose moving forward. We listened to consumers and carers, to our staff, our sector partners and our funders. What we heard loudly was a need for us to use our experience and research to advocate for an improved mental health system. People want to hear from us on the issues that matter in mental health, homelessness and suicide prevention. Last year we made several important submissions on policy and reform, and we'll build this activity moving forward. In my first year as board chair, we continued to focus on maintaining good governance and accountability. We'll continue to make sure we are efficient and responsive to achieve our mission. We are in a good position to maintain a sustainable organisation, one that is financially healthy and fit for purpose.
During the year, a key priority was refreshing the collaborative recovery model, which is the foundation of our services and informs much of what we do, regardless of the service setting. Partnerships are essential to delivering outcomes across regions and sectors. When we're addressing mental health, homelessness or complexity, we know that it takes a network, all working together to support each person. It also takes partnerships to bring about system change. There are great stories in our annual report website of staff putting their values into actions for our consumers, whether in community-based outreach, residential settings or out on the streets.
This extraordinary year has shown us how quickly and dramatically things can change. Neami and MeWell have learnt that we can maintain our support in a crisis and keep focused on the outcomes for individuals. Throughout, we've continued to deliver our vision of full citizenship for all people living with mental health issues in Australian society.